Thank you for joining the Office for Human Research Protection's webinar series on the Common Rule. Today's webinar, The Who, What, Why, and Where of IRB Meetings and Membership, will be presented to you by Public Health Program Specialist Michael Grappaldi. This webinar will be recorded and will run for a total of 60 minutes, including a live Q&A session. If you have questions, please submit them through the chat. Certificates of attendance will be issued to all who have registered. The slides will be available on OHRP's website under the Past Events section, and the recording will be available in around a month. We will go ahead and get started.
Thank you, Zena. And so let me just make sure that I am sharing my screen properly. And my telescreen should be visible. Please let me know if it's otherwise not. But everyone, thank you for joining. Good afternoon. My name is Michael Grappaldi, as Zena said, and I'm a public health program specialist at the Office for Human Research Protections. Today's presentation is called The Who, What, Why, and Where of IRB Meetings and Memberships. A quick disclaimer before we get started. Any opinions expressed in the course of this presentation are my own and do not necessarily reflect the policy of the Department of Health and Human Services or the Office for Human Research Protections. Any references to the regulatory provisions in the Common Rule in this presentation have been simplified to facilitate understanding. Please always refer to the actual text of the Common Rule, which is available on the OHRP website for a complete and accurate description of the regulatory requirements. So here are the learning objectives for this basic level webinar. We'll talk about Institutional Review Board, or IRB, basic operations. We'll explain the different membership requirements for the IRB, and we'll cover what quorum is, as well as the voting process for a convened meeting. Hopefully we'll answer and get to all of those W questions that are in the title. And for those wondering about the how, I thought about this, and I think it kind of in a way started with this webinar series last week with Mariana's presentation. We'll cover some of the how the IRB reviews research today, and also go into the third presentation next week. Okay, very basically, let's start with what is an IRB. Well, an IRB is a committee of experts that applies regulations and ethical standards to ensure that research is conducted safely, ethically, and legally. While the Common Rule, which is 45 CFR 46 subpart A, is usually thought of when applying federal regulations, other subparts may apply depending upon the research population, such as if you have pregnant women, prisoners, or children. Additionally, there could be other federal laws that apply, such as those from the Food and Drug Administration. The Office of Civil Rights under HHS administers HIPAA, and there are also likely to be institutional policies and even possibly state and local laws. Now, the regulatory requirements of the Common Rule apply when there's non-exempt human subjects research that is conducted or supported by a Common Rule agency. So OHRP is the government authority for research that's conducted or supported by HHS, but there are 20 other departments and agencies who have adopted the Common Rule. So if the research is conducted or supported, and note that this goes a little bit beyond funding, right? Funding is a subset of support. Look to that specific agency to see if they apply the Common Rule. So for instance, the Department of Defense has adopted this regulation. It's 32 CFR 219. Note that's a different Code of Federal Regulation citation, but the text is the same. And on our website, we have a list of the Common Rule agencies and their corresponding code sections available. So it's not a requirement that each institution has its own IRB. And if an institution does a lot of non-exempt human subjects research, it might make sense for them to have one. But for an institution that infrequently conducts non-exempt human subjects research, the cost and administrative burden of maintaining an IRB might not make sense. For whatever reason an institution chooses, it can opt to have its research reviewed by an external IRB. In these instances, an agreement should be in place between the two institutions that outline the duties and the responsibilities of each. Not all human subjects research requires an IRB review according to the regulations, right? Only the research that is non-exempt and funded by a Common Rule agency, or rather conducted or supporting, with funding being a type of support. So some exempt categories require limited IRB review, and we'll discuss those next week. Projects that fall into the categories of not research or not human subjects research, as well as the majority of the exempt categories, do not require an IRB review. It is possible, however, even though the regulations do not require it, that an institution might decide under certain conditions to still have some sort of ethics review that might resemble an IRB review for research that falls into one of these categories. The regulations provide a floor for protecting participants, and an institution is free to raise that floor or add additional requirements as they see fit. So for instance, as a matter of policy, an institution might decide that all research that examines, say, suicidal ideation might require some sort of ethics or IRB review, even if that would otherwise fall into an exempt category or not have to follow the regulations. So it's each institution's prerogative to decide if it wants to add any layers of protection beyond what the regulations require or what to do when the regulations do not apply. IRB oversight is continuous. It's not a one-time, hey, thanks for submitting the research, we've reviewed it, here's your approval, you're good to go. And on the next slide, we'll talk, and next week, we'll talk a bit more about kind of the common life cycle actions that the regulations have information about. And something that's not found in the regulations, I'll point out now that many institutions have is in fact closure policies. These reduce the number of active studies at an institution and also reduce the administrative burden of the IRB because there's less studies for them to oversee. So the regulations do a great job of providing the requirements for IRB approval. And if you're interested in those, my colleague Mariana did a fantastic presentation on the 111 approval criteria last week. And that will be available for viewing on our website shortly, as well as this presentation, and the slides will be available in due time. What the regulations do not do, to the celebration of some and the chagrin of others, is tell institutions how to implement these review requirements. That is, for instance, the regulations will tell you when research requires a review at a convened meeting or through the full IRB board review, but they do not tell an institution how to do this review aside from applying the regulations. Now, it's because each institution is different in size, resources, the type of research that it reviews, etc., that these flexibilities are so valuable because each institution can decide for itself how to implement them. So the regulations just tell you that IRBs have to have policies and written procedures, and then each institution can fine-tune those procedures to meet its own needs. The regulations require that an IRB must develop policies dictating how initial and continuing review will be conducted. Now, under the revised Common Rule, continuing review is no longer required by the regulations for research that initially proceeds through an expedited review. But again, an institution is free to enact additional requirements. An institution might decide that they want to keep a pulse, keep an eye on these studies, and as such, they might ask for a summary or a snapshot of what's happening once a year. The IRB needs to notify the investigator and the institution of its determinations, say whether the research was approved or might require changes before it can be approved. This is normally submitted through a letter that's electronically, right? You can email or through your IRB system, you get a notification, but that's up to each IRB to decide how that's done. The IRB needs to have a mechanism for researchers to submit changes or amendments to the protocol. The regulations say that when changes are made, that that they must be approved by the IRB prior to implementation. Now, there's an exemption that allows for changes to occur prior to IRB approval if it's to avoid immediate harm to the participants. As well as the IRB is also required to have policies for submitting reportable events, which are things like unanticipated problems, serious or continuing non-compliance, and how the necessary officials from different institutions will be contacted concerning those events. The regulations also state that there must be policies for reporting the suspension or termination of IRB approval. Now, again, the regulations say that an IRB must have these written policies governing these topics in place. But what those procedures contain is up to the IRB. The ability to customize these policies to each institution is really a gift if you're willing to accept it as one. So what else do the regulations say that an IRB needs? Well, an IRB needs a location, a space to have its meetings. This would be the where for those of you keeping track of the W's that we're discussing. Now, space can be virtually, of course. And on the whole, the IRB community did a fantastic job in protecting research participants during the pandemic. Many operations were made virtual, demonstrating that in-person meetings and having a physical, tangible space are not absolutely necessary. The regulations also say that IRBs need sufficient staff to support the IRB operations. What is sufficient? Now that's not defined, but for those of you who are looking for more resources, being able to point to a regulatory requirement could aid in your appeals to your institution for a request for more funding or more staff. An IRB needs members, of course. The regulations state that the IRB must maintain a list of members, and this requirement is commonly interpreted as IRBs need to maintain a roster. So we can use that term colloquially, informally, we'll say, moving forward, even though it's not found in the regulations. The roster needs to have the proper biographical information of each member, including the experience, any sort of board certifications or licenses, as well as they should also describe each member's chief anticipated contributions to the IRB discussions and deliberations. Now, a lot of this can be detailed through a resume or CV. The roster has to state the members' roles, which we'll cover in a bit. For example, if they are a non-scientist or an unaffiliated member, or they could maybe even be both. Sorry for the spoiler, but we'll get to that in a bit. And speaking to affiliation, the roster must list the relationships of each member to the institution. That is, for instance, if they're a full-time employee, part-time employee, anything like that. So there's a lot to unpack here when it comes to our IRB membership. So let's just jump ahead to that. On to the who. So the regulations stipulate that the members should be thoughtfully considered with a particular emphasis on their experiences and perspectives. Having a diverse composition of the IRB ensures that participants are adequately protected. To do so, this requires that many different characteristics are looked at. Certainly, the IRB as a whole must be able to review proposed research in terms of institutional commitments and the regulations. This means that membership must include people who are knowledgeable in these areas. It's expected that the IRB will have members with the appropriate expertise with respect to the type of research that the IRB regularly reviews. So, for example, an IRB that routinely reviews psychology research would be expected to include at least one member with an expertise in psychology. While education and training are the factors typically thought of when considering membership, the IRB should also look deeper to consider the board's makeup by having different races, genders, and cultures present on the board that represent the community that the IRB is serving. It makes sense that if you're working with a certain group in the community, you should have that community's voice represented on the IRB. Now, this is a great way to build trust with the community by ensuring its appropriate viewpoints are incorporated into the reviews and the discussions of the IRB. And so you can consider having community leaders serve on the IRB. Certainly maintaining a meaningful IRB roster could also include having an SOP that covers how IRB members are brought on board, the training requirements, a plan to keep their expertise current, and a plan to broaden engagement. If an IRB regularly reviews research that involves a category of subjects that's vulnerable to coercion or undue influence, such as children and prisoners or those with impaired decision-making capacity, to name a few, consideration shall be given to the inclusion of one or more of individuals on the board who are knowledgeable and experienced in working with these groups. Very quickly, I want to point out that the regulations have additional membership requirements for the IRBs that review prisoner research, as defined in 45 CFR subpart C. The IRB must have at least one member who is a prisoner or is a prisoner representative. Given the previous requirements to have a board that adequately represents the population participating in research, as well as the requirement that we have these added protections for vulnerable populations, it makes sense that we have an additional subpart that would govern a group as vulnerable as prisoners. Now, if a prisoner representative is used, their experience should relay that they can adequately speak on the perspective of what it's like to be a prisoner. So this person may have been previously incarcerated themselves, they might work within the prison system, or they might even work with recently released individuals. The regulations also stipulate that the majority of the board cannot be affiliated with the prison. And later in this discussion, we'll talk about affiliation. I promise you, I realize I've brought that up a couple of times. But the most common ways to be affiliated are to be employed by that institution or being an immediate family member of someone who's employed by that institution. So like a child or a spouse. So most IRBs don't do prisoner research, but I just want to include this because it's an additional IRB membership requirement that you should be made aware of. So let's talk about the composition of the IRB. We know that we have to have members who are qualified to review the research, but also we have specific roles that must be addressed by the IRB. First and foremost, we have a minimal number. IRB must have 5 members. This is the absolute minimal. Institution can require that IRBs have more. And there are advantages and disadvantages to this. Some benefits would include being able to review a larger swath of research, right? Because presumably you'd have more areas of expertise that you could cover. Also, in theory, there'd be an increased variety of perspectives, providing different valuable input when you review research. We'll discuss primary and alternate members in a bit, but the basic gist is that an alternate member can fill in for a specific primary member. So more alternates mean that when a primary member can't fill in, that you'd be able to have somebody fill in and meet the quorum requirements, which we'll also discuss in a bit. A possible disadvantage to having a larger number would be scheduling. It's a lot easier to get 5 people in a room together than it is to, say, have 10 people get together. Or I'm sorry, online virtually. So this, of course, it might have an effect negatively on the IRB's ability to review research if you can't meet quorum, if you have too many members. So an IRB must have at least one member whose primary concerns are in the scientific areas. This person is informally called the non-scientist. Similarly, the IRB must have at least one member whose primary area of expertise is in the sciences. And you guessed it, this person is referred to as the scientist. Usually obtaining the scientist is not an issue for IRBs. Normally, the majority of the board is IRBs, and you'd have 1 or 2 non-scientists. And the regulations say that this is the minimum. You need 1 of each, but there's really no maximum according to the regulations. So in theory, you could have an IRB consisting of 4 non-scientist members and 1 scientist member. But remember that the IRB as a whole must have the proper credentials to review the specific research coming to that IRB. So for that reason, it makes it unlikely that you'd have an IRB that's 4 non-scientists and 1 scientist, but in theory, such a board could exist. So each IRB must have at least 1 member who's unaffiliated with the institution, and we'll be getting to this in several slides, I promise. And this member is routinely referred to as unaffiliated or community. And it's possible, as I alluded to earlier, for 1 member to occupy multiple roles. That is, it's very common to have the non-scientist also be the unaffiliated member, for example. The regulations mention but do not define an IRB chairperson. What we know is that the IRB chair can perform expedited review or designate which IRB members are qualified to perform expedited review and delegate this responsibility to them. As such, an IRB roster would normally name who's the IRB chair, but having an IRB chair is not a requirement like it is saying having a non-scientist or a scientist. The regulations also permit the use of experts to assist in the review of research. An institution can establish a policy for allowing someone outside of the IRB to provide expertise in an area when either the IRB lacks it or the IRB might have questions about it. So for instance, an IRB that primarily reviews adult clinical trials may need to consult with a pediatrician or pediatric specialist if they're reviewing a clinical trial involving children. When experts are used, they're simply providing their expertise to the IRB, and they're not actually members of the IRB. This means that they cannot vote. Similarly, the IRB might have IRB administrators present who can answer questions or maybe have done some pre-review work for them. And the institution might also allow guests to attend, possibly potential members or possibly someone higher up the chain of command. Now it's up to the IRB to decide whom they will allow to attend the meeting, and the IRB minutes should always reflect who's in attendance. But this is one of those policies, the flexibilities that institutions and IRBs have in deciding whether or not non-members can attend meetings. We receive a lot of questions about who qualifies as a scientist, or should I say non-scientist at times. So OHRP developed this question to ask, when taking into consideration the entirety of a person's experience, would they view the activities being reviewed as someone who is in a behavioral or biomedical research discipline? Now, please note that the behavioral research discipline is included, and this means that a psychologist or possibly an anthropologist could meet this standard. So in other words, it extends beyond the typical biomedical research fields that we think of, like medicine and any of its subspecialties. So with that question, if you answer yes, then that person can be a scientist for the purpose of fulfilling that role. If you answer no to that question, then the person could meet the regulatory requirements for being a non-scientist. So this is somewhat of a subjective standard, but there are objective elements that can be used. So look to a person's education and look beyond just the degrees, right? Consider their current job as well as the previous jobs they've held, but not just the titles. Actually look at the duties and responsibilities they've held. This is a very fact-specific determination, but the IRB should be sure to document how a member is either a scientist or a non-scientist. As a reminder, regardless of the classification of scientist or non-scientist, an IRB as a whole must have members who have the competencies to review the research it sees. This does not mean that every member of an IRB at a cancer hospital must be oncologists, right? But you would certainly expect to have medical professionals who specialize in cancer research or cancer care serving on the IRB. Okay, so let's take a look at an example. Dolph Lundgren, who many in the audience might know as Ivan Drago from Rocky IV, and I don't watch a lot of movies, so perhaps he's more famous for a different film, but he's been asked to join a local IRB. And I'm sure many of you are thinking right now, like, what? But just bear with me. Dolph is actually a very accomplished scholar, and this is true, you can look it up. I'm not making this up. He has 2 degrees in chemical engineering and earned a Fulbright scholarship to Massachusetts Institute of Technology. This is really crazy. What did he parlay all that education into? Well, he has over 100 credits to his name as an actor, producer, and director. So clearly he's a man of many talents. But getting back to the scenario, the local IRB, local university IRBs, it reviews mostly social behavioral research. So we want to know, is Dolph likely to qualify as a scientist for this board? So let's ask the question from 2 slides ago. Does his training, background, and occupation incline him, sorry, this pop-up is throwing me off, to view scientific activities from the standpoint of someone within a behavioral research discipline? And I altered that slightly since it's CBER research. So I'll give you a second to answer. And we're having the numbers coming in now. I can see them. Could take a sip of water too. All right, I'm gonna stop it here. It looks like most people have come in. And I'm trying to share the results now. 52% said no, probably, and 48% said yes, probably. And hopefully you can see that. I know we had some issues last week. So there we go. Probably not. So for the last 40 years, Dolph has been in the movie industry. He would most likely not view research from the standpoint of someone within a behavioral research discipline. His expertise would seemingly lie within the discipline of making movies, which is a totality of his experiences for the better part of his life. At one time, he was a very gifted chemical engineer, but that was over 40 years ago. So please note that OHRP takes a complete view of the person as a whole, while other agencies like FDA are willing to just look at the educational requirements. So it's important to take that into consideration. So what about Dolph serving as a non-scientist on the IRB? Might he qualify as a non-scientist? And perhaps I gave that away with the last slide, but please select your answer now, and we'll talk about that in a bit. Comes in real fast. It's kind of fun to be on this end of things. All right, it looks like it's starting to wind down. So I'm going to end the poll. And we have 94% said yes, probably. 6% said no, no, possibly. And I'm trying to share the results now, so hopefully you can see that. And yes, so I would argue yes. He does not come from the viewpoint of someone within a scientific discipline, right? Additionally, it could be possible that his decades of working as an actor and a director have given him proper experience to understand the human condition, and he might be able to actually provide some unique perspectives in serving as the non-scientist member on this particular IRB. Let's take a look at another example. So here, Sally is a professor and a researcher at State University in the epidemiology department. She's going to be serving on the IRB, which primarily does observational research that consists of longitudinal studies. Sally, inspired by Dolph in Rocky IV, wanted to become an actress herself. And she was quite accomplished. You know, she earned a bachelor's in theater and then a master's of fine art from Juilliard. But it seemed that she also had some other aspirations and interests. So she finished acting and went on to earn a PhD in statistics. She's been an associate professor for 15 years and has received $2 million in grant money from the National Institutes of Health for her research. Could Sally serve as a scientist for the State University IRB? So let's ask, does Sally's training, background, and occupation incline her to view scientific activities from the standpoint of someone within a behavioral or biomedical research discipline? And you'll see that the survey questions popped up, so I'll give you some time to answer that. It looks like we're starting to slow down here, so get it in one last chance. Okay, so we have 88% said yes, probably, 12% said no, probably. And hopefully that's coming up, or my verbal explanation is sufficing. So let me close that out. And yes, yes, probably. Sally's experience as an active researcher and professor in the epidemiology department is likely to incline her to view these scientific activities from the standpoint of someone within a behavioral or biomedical research discipline. So for this reason, Sally likely qualifies as a scientist. So the regulations require that we have at least 5 members on an IRB with a non-scientist, a scientist, and an unaffiliated member. And we're finally here, even though I've referenced this a few times. So how do we know if someone's unaffiliated or not? And this is a bit confusing because it's actually defined in the negative. That is, by knowing who is affiliated, we can know who is not affiliated or unaffiliated. So look to the existing relationships between the member and the institution. The common relationships are those that I mentioned earlier, being employed or being closely related to someone who is employed. So to this end, an employee or an agent of the organization that's registering the IRB or a person of that member's immediate family is considered to be affiliated. Affiliated members include, but they're not limited to, you can see on the screen, part-time employees, current students, members of a governing board, but also other things, other roles like healthcare providers holding credentials to practice at an institution, and even volunteers working in an institution on business unrelated to the IRB. Those are kind of more small and nuanced. An individual that has no affiliation with the organization registering the IRB, other than being an IRB member, is considered to be unaffiliated. Unaffiliated members can include people whose only association with the institution is that of a patient, subject, or a former student at that institution. Now, paying an unaffiliated member for their services on the IRB does not make them affiliated, and it does not cause a conflict of interest. So this is a small nuance here, right? If you're an employee and you're paid as an employee, you're affiliated. But if you're paid for your role as a member on the IRB, you're not affiliated. Like most things in the IRB world, this is a very fact-specific driven determination, but we do provide some details and descriptions for trying to help out who is not affiliated. And using our previous examples, from the fact patterns we've been given, Dolph would likely qualify as an unaffiliated member because the only relationship specified is that he's serving on the IRB. But Sally, as an employee of the university, would be an affiliated scientist member. So the regulations do not mention alternates. So of course they are not defined in the regulation, but OHRP has allowed institutions to identify an alternate member for a specific primary member. And the alternate member fills in for the primary member who is unable to vote at a meeting. So the alternate is not just anyone that can serve on the IRB, but it closely, or he or she closely mirrors the primary member with respect to their expertise, their experience, their background, their knowledge, their professional competence, things like this. So an alternate is designated to fill in for a specific primary member, not just anybody at large. Frequently, IRB rosters will denote who is a primary member and who is an alternate. And if the person is an alternate, on that roster will designate who they are permitted to fill in for. Excuse me. Keep in mind that an alternate's role should be the same as the primary member when it comes to being classified as a scientist, a non-scientist, an unaffiliated member. Now, if both the primary IRB member and his or her alternate are at the same IRB meeting, OHRP is going to assume that the primary member is the one acting as the official voting member of the IRB when it comes to the review of the research protocols, unless the minutes state otherwise. So a designated alternate may substitute for the IRB primary member for an entire meeting or at any time during the meeting. And substitution at the meetings commonly occurs when a primary member is absent from the room for part of the meeting or recuses him or herself because there's a conflict of interest with respect to a specific issue that's being reviewed. When an alternate is a substitute for a primary member, this is the only time that they can vote. OHRP recommends that the reason for the substitution of the alternate IRB member and who they are filling in for are documented in the minutes. I want to take an opportunity to highlight one of our free resources, and actually all of our resources are free, but we have a IRB training checklist for someone working with IRBs. The training checklist provides basic training on human research protections for someone working in the field, and individuals who might benefit from this could be new IRB members, including the unaffiliated or community member, IRB administrators, investigators wanting to know what to expect when they're submitting protocol for review, and existing IRB members who want to brush up. We have two other checklists. One is for community individuals curious about learning more about an IRB, also a checklist for investigators. And again, these are free on our website. All right, now that we've covered the who, let's get on to more of the what, right? So for items that cannot be reviewed via an expedited review mechanism, and we'll cover this next week, research must be reviewed through a convened meeting of the IRB. A convened meeting of a majority of the members includes the non-scientist. Now, when I say members, these would be considered the primary members, right? Or an alternate who's replacing a primary. And we'll discuss this requirement, which is known as quorum, in a little bit. The IRB will review research actions and vote on them, and the IRB minutes must document with specificity which actions are being reviewed and what decision or decisions the IRB took. So as an example, the minutes might say something like initial review of study 1, 2, 3, 4, and then detail the discussion and the outcome. The IRB has the ability to approve research as is, require changes in order to approve, meaning that the changes are made to the protocol and the informed consent document or flyer, what have you, and then they're resubmitted for approval. The IRB can disapprove research, which doesn't seem to happen too often, but they can also table research to discuss at another time. And tabling can be done for a variety of reasons. This could be because there's a lack of expertise on the IRB at the time because maybe some members aren't present. Or also it could be a time constraint, like maybe there aren't enough minutes left in the meeting to thoroughly review protocol action. As mentioned earlier, minutes can take place in person or virtually, and either is permitted by the regulations. We've offered guidance permitting virtual attendance, provided that those who are not in person have received the necessary materials ahead of time. And in reality, all members should review the materials ahead of time, right? Members who have not reviewed the materials for an IRB action should recuse themselves from the voting because they don't have the information to be able to provide an informed decision and an appropriate vote. The IRB minutes should document who attended, and if the individuals did not attend in person, it should say how they attended. So for instance, Mr. Smith, Dr. Smith attended online through a video platform, or Dr. Jones attended the meeting through a telephone. So in order to have an official convened IRB meeting, we have to have quorum. And quorum is going to be your favorite word or your most hated word by the end of this. Quorum is the majority of the designated primary members and the non-scientists. This means that quorum is not reached if there's either a minority of the primary members or if the non-scientist is not present. Bear with me as we'll have a little bit of math. I know that's not everybody's favorite subject, but this is kind of arithmetic and I think we can get through it. So to calculate the majority of the IRB members, it depends on whether you have an odd or even number. For an even number, divide the number of primary voting members. So if you're keeping a roster that includes both primary and alternate members, we are only looking at the primary members. So take that number, divide by 2, and then add 1. So if we have an IRB that has 10 primary members, 10 divided by 2 results in 5, but we need a majority, right? Not half of the members, but we need a majority, not 50%. So 5 plus 1 equals 6. So in order to satisfy quorum, we would need 6 members present at the meeting. And don't forget, we have to have the non-scientists there as well. I think odd numbers are a little easier because you don't need to remember to add the 1. You can't have half a person, right? So just divide the number by 2 and round up. Here we have 11 primary members. You divide by 2, you end up with 5.5. You round up. So in this instance, you would need to have 6 of the primary members present and the non-scientist for quorum to be met to have the meeting. Quorum is needed throughout the entirety of the meeting. Attendance should be taken at the start to ensure that a majority and the non-scientists are present, and then kept track of throughout the meeting. Maintaining quorum is necessary to vote on research actions. If there's no quorum, then the IRB can't approve or disapprove any actions. Because of the necessity to maintain quorum, the minutes need to detail which IRB members are present for which items. It's also necessary to write down who came in late, who left early, or who stepped out. And again, with today's virtual meetings being such a common occurrence, those attending online should leave their cameras on so their presence can be noted or their absence can be noted as required. If someone's participating by phone, they should be sure to give a verbal, hey, I'm leaving, as well as, hey, I'm back, to announce their attendance for that particular action item. So let's take a look at an example. Tech University's IRB has a roster that consists of 10 primary members and 4 alternates. So this is their paper roster. We are told that at the meeting, there are 7 primary members present, including the non-scientist, but the unaffiliated member is missing. Does the IRB have quorum to review these 3 initial reviews? Now, I'll give you some time to think about this because there's a couple things to think about as we just discussed. Spencer, if you could pop up the quiz question. Thank you. So again, we're trying to figure out if we have quorum or if quorum is not met. Thank you, Spencer. I appreciate that. And the results are still coming in. Okay, it seems like the majority of you have voted, still very slowly coming in. So we have 74%, about 3/4 of you said yes, and we have 26% said no. So hopefully you saw that, or my verbal explanation suffices. And then there we go. Yes. So this one was a little tricky for a couple of reasons, but the majority of you got it, which is fantastic. So first, let's recall the definition of quorum. It's a majority of the primary voting members and the non-scientist. We are told that there's 10 primary members. So applying our formula for even numbers, 10 divided by 2 equals 5. Then we add 1 to receive a majority, right? We don't need half, we need the majority, and that's 6. And I did the math for you on the previous slide, so hopefully you remember that. So we need 6 members, and we're told that we have 7 members present. So 7 is greater than 6, we have quorum. One possible mistake that would have been made is to add the alternates for the purposes of quorum. If you did that, then you'd have 10 plus 4, so 14 divided by 2 would give you 7. And then remember, it's an even number, add 1, so 8. But this is not the case because we don't count the alternates when considering quorum. The second requirement is that we have at least one non-scientist. Do we have a non-scientist? Yes, we're told that Father Ignatius is present. While an IRB must have an unaffiliated member, the unaffiliated member is not a requirement for quorum. Now, I know that's a little tricky. It's a little nuanced. So another possible pitfall would be thinking that Ms. Bluth had to attend the meeting for quorum, but this is not the case. So this one was a little tricky, but about 3/4 of you got it right. Congratulations. And for those of you who didn't, hopefully you're able to follow the logic and it makes sense now. If not, as always, we answer questions at the end. Okay, we talked about membership, quorum, and even the actions that an IRB can take, but we have not yet discussed voting. And voting also requires a bit of math, but it's the same formula we applied, so I think it's quite manageable as it's this basic arithmetic and the majority formula that we've been using. So to begin with, we have to have quorum. When a vote occurs, the IRB minutes must be detailed enough to show the vote of each primary member on the action, right? This includes showing who voted for, meaning approval, who voted against approval, and who abstained. If we have 7 primary members present for an action, the minutes might reflect that 5 members voted for approval, 1 voted against approval, and 1 member abstained. Now, there are several reasons why a member might abstain. For instance, they might have missed part of the discussion by arriving late, or they didn't have the opportunity to review the research ahead of time. Recusals occur when a member has a conflict of interest. If a member recuses themselves, the minutes should note which items the member had the conflicts of interest. Conflicts of interest are routinely thought of as being financial, but they can also exist beyond that. Like if I was reviewing the research of my supervisor, that would be a perceived, if not an actual, conflict of interest. The regulations do say that a conflicted member cannot vote on research action items. Unlike abstentions, recused members do not count towards quorum. So we need to maintain a majority and the non-scientist for quorum. When a member abstains, their presence counts towards that majority. A recusal, on the other hand, has the effect as if the member were not in attendance at all, just that they weren't there, that they didn't show up. As an example, if we have 8 primary members, but 1 member must be excused for a conflict of interest, the minutes might note 6 for, 1 against, and 1 recused due to a financial conflict of interest. This item would be treated as if there's only 7 members present for quorum. Because remember, in the instance of a recusal, we act as if the person is not there. Approval requires a majority of the voting members who are present at the meeting. This is different from the total number of the primary members on the roster. It's very common for not all of the primary members to be able to attend a meeting. And voting may only occur at the meeting. So individuals cannot vote ahead of time, and they cannot send a proxy to vote for them. Now, members who can't make the meeting are allowed to send their opinions and thoughts, and those can be used in the discussion, but voting only occurs at the convened meeting in real time. So using what I have on screen as an example, quick example, if we have 7 voting members present, applying our majority formula, 7 divided by 2 is 3.5, we would round up to get 4. So in order to approve an action, you'd have to have at least 4 members voting for in that instance. So let's go forward with an example. And this one is also a bit of a thinker. I hope that you guys get it, that I've done a decent job explaining it. So recall the rules for calculating the majority, both for quorum and for approval. Going back to the Tech IRB, which we saw 2 slides ago, we have 10 primary members with 7 primary members present and 4 alternate members present. We also have Father Ignatius, the non-scientist. We're told that one of the primary members, Dr. Delaney, is presenting his own research, so he cannot vote due to a conflict of interest. How many votes are necessary for his study to be approved? And so I'll give you some time to think about the various issues that you have to troubleshoot with this and what questions you need to ask and answer. And Spencer, oh, thank you. There it is. So the results are still coming in. And this is interesting. At least I think it's interesting. Only about half of you have participated. I suspect that's because many of you are thinking about this, and this is, in my opinion, a thinker. But we are starting to, I will leave enough time for questions. So I think I'm going to go ahead and stop this. So we have that 39% of you said 6, followed by 35% of you said 4, 16% said 5, and 8% said that we don't have quorum and that the results, that we can't have a vote. And so the answer is 4, and I guess I need to do perhaps a better job of explaining this. So let me go through my thought process, and hopefully we can work through where people came up with different answers. So we have a lot going on here, as I mentioned. The first question that we should be asking is if we have quorum. Quorum requires the majority of the primary members and the non-scientists to be present. So as we determined in the previous case, case number 3, 10 divided by 2 equals 5. 5 plus 1 is 6. So we need 6 members, with one of those being the non-scientist, Father Ignatius. Here we had 7 members, but with Dr. Delaney's recusal, we're left with 6 members. So we still have quorum met, right? We have 6 members. But we also need to know the number of the voting members present so we can figure out the majority. And so looking to the fact pattern, do we have an alternate who can fill in for Dr. Delaney? Can one of the 4 alternates sit in for him? And we were told specifically no, that there's no designated alternate for him. So we're left with 6 voting members at the presence of this board. So the next step, once we've established that we do have quorum and that we have 6 members, is to come up with the majority of those 6 voting members. So applying our formula, 6 divided by 2 equals 3, plus 1 equals 4. And so 4 is the majority. We must have 4 members voting for approval in order for Dr. Delaney's research to be approved. And just a quick reminder, the minutes should reflect that Dr. Delaney recused himself on a specific action, and it should mention that he has a conflict of interest. So we've come to the end of the webinar, and I want to highlight some other resources that we have available. As always, please feel free to email us at ohrp@hhs.gov. Please mention the funding, or if it's being conducted or supported by a particular agency, as well as if you check the box. And so I provided a brief overview to some very complex topics. And so if you're interested in learning more about IRB membership or quorum and voting, we do have some mini tutorials on that. I'd like to take a quick couple moments to highlight some upcoming OHRP educational events. If you joined us early, you might have seen that we have this slide rotating, that we have our 6th annual exploratory workshop coming in at the, I guess, end of summer, September 14th. And this year's event is going to explore the ethical and practical considerations for research involving psychedelic substances with human participants. The event's going to be live streamed for free. You don't have to register like one of these events. And you can go to the website to learn more about the different topics and to be discussed, as well as the biographies of those being presented. And this is just a really timely topic, right? It seems like every time you open up Washington Post app or your news app or newspaper, there's something about psychedelics in the news. On September 26th and 27th, we're traveling to Ann Arbor, Michigan to host the Research Community Forum with the University of Michigan. And so this is an in-person event only, though there'll be no online option. But the first day is going to have interactive workshops on the Common Rule and regulatory requirements from myself, Dr. Yvonne Lau, and Dr. Natalie Klein, as well as some of our colleagues from the NIH will be presenting there as well. So please consider attending that. Thank you for your attendance and your time. I hope that this presentation was informative and that you're able to learn something. And so at this time, we'll take some questions. Please submit your questions in your chat, and Mariana will be moderating.
Oh, don't you worry. There are already so many questions.
So many questions
for you to answer.
All right. Let me stop sharing.
So I'm going to go back to the beginning and start asking in that order. So with respect to IRBs having sufficient staff and resources, the question is there a general rule for what is considered sufficient staff time for an IRB based on the number of studies that it is likely to review per year?
Yeah, so it gets down to the specifics, right? An office of one that's reviewing one greater than minimal risk study per year seems pretty doable. You wouldn't need a full-time employee to do that, right? But if you have a robust research portfolio consisting of several hundred protocols, you're going to need an office that has multiple members, right? Because you're not just talking about the initial review, you're talking about amendments, you're talking about the reportable events that are coming in. For greater than minimal risk research, you'll have your continuing reviews. And so basically, there's not a hard and fast cut and dry rule for what is sufficient. I would say that if you feel as though your HRPP office, your IRB office is stretched thin to ask for those additional resources, right? But it also gets down to who's in your office, right? A new IRB administrator who's just a year or two on the job won't be able to review as fast, presumably, or apply the regulations as well as someone who's been in that position for a while. So I hate the answer, it depends. I hate the answer, it's fact dependent, but it really is here.
Yeah. Another question about who should be represented on the IRB. So I'm at a school where research will be limited to the social sciences, and students are most often used as a group of human subjects. Should the IRB include a student representative? And would that be somebody or possibly a member of the staff who oversees student life? Would that suffice?
Yes, I think that's a fantastic idea to include a student representative. That's not a requirement in the regulations. Students are not deemed to be a vulnerable population, but that'd be fantastic to include a student who has that viewpoint. Now, as I said before, a student would be an affiliated member, right? A current student would be an affiliated member. So one thing that you might want to think about doing is having a student who's graduated, someone who's been through the research before and actually has that experience as a research participant and also experienced student life on your campus. They could also serve on your IRB and they would be an unaffiliated member. That's sometimes tricky to get the unaffiliated member, so just a way that you could do it. The other suggestion of having a dean or someone who oversees student life, they should presumably have a pretty good pulse of what the students are going through, right? And they should be able to voice the opinions and have valuable perspectives to give on student research.
So you've actually just raised a question that we did get in subsequent parts of your presentation. As it's on topic, I'll raise it now. There were questions about alumni of schools and their affiliation, so whether they can be unaffiliated members on an IRB, and also about retirees.
Yes, alumni can serve as the unaffiliated member, right? If they were only went to that school and they don't maintain an active involvement. Retirees can be a little bit more tricky. I believe if you're actually receiving your pension from that employer, that maintains that affiliation that's present. But if you worked somewhere and then you retire and your only affiliation is being a prior member and you're not receiving those benefits, you can serve as the unaffiliated member. And Mariana, I don't know if you have anything to add to that.
No, that's my recollection as well. We've received this question quite a number of times, and that is, I believe, our typical interpretation of that.
Yeah.
So another question on retirement. So when an IRB member leaves the institution for retirement or other purposes and alternates are not available, what is the process for reviewing any full board protocols? Should all IRB activities be stopped until all member spots are filled?
So you need quorum to review. So from this question, it sounds as though that maybe it's a 5-person IRB and this one member is always one of those people that's always there. It's always one of those 3 necessary. So in this case, you would have to fill that. You're allowed to have vacant primary spots so long as you can meet quorum. So if your roster says we have 7 primary members, but someone retires and you're left with 6, you could then alter the roster to say that you have 6 primary members, right? You don't want to put yourself at a disadvantage already being down 1. But if it gets to the point where if you have a roster that consists of 5 primary members, you're down 2 and your 3rd retires, you do need to fill at least one of those roster spots and make sure that you have the non-scientists as well for the actual meetings.
There was a question about how long it typically takes to update an IRB roster with our office. I checked with our colleagues in the Division of Policy and Assurances during the webinar, and it is my understanding that if the submitted roster is complete, you should anticipate approximately 5 business days for that to be processed and approved. Now, another question about the IRB chairperson. So you said that this is not a regulatory requirement like an unaffiliated member. Is that correct? Our chairperson is retiring later this year, and we were considering the potential of having 2 people serve as co-chairs. Is that permitted?
So the regulations don't say that you need to have an IRB chairperson. So from that point of view, it's not a regulatory requirement. But if you're conducting expedited review, you would need a chairperson to either do that review or to designate who has the expertise to be able to do that. As far as having 2 chairpersons, I don't know why that wouldn't be allowed. Certainly if you would have one person be the primary, if you want to go this way, and have one person be the alternate. But oftentimes it is helpful to have one person take on that responsibility and be listed as the chairperson. It could be, I know certain institutions have different IRBs for different research. So if maybe you're considering 2 chairs because one is very heavy on the biomedical research sciences and one's heavy on the CBER, member, you could, in theory, have one be the chair of the CBER and one the chair of the biomedical research. I'm not aware of anything prohibiting 2 members. The regulations just mentioned singular chairperson. Mariana, I don't know if you have any comments about that, but
I was going to weigh in that from prior experience, I've worked at institutions where the roster would designate a chair and a co-chair, and they would be interchangeable for the purposes of absences. In other words, the co-chair would serve as the chair in the event that the individual designated as a chair was absent. But I believe it was a matter of alternate assignment for those purposes. But you're right. I don't know if the regulations explicitly address this or prohibit it. It may be a question to ask the rest of our office. I know we're almost at time. I'll end with this one. So with your example of Mr. Bungden, wouldn't it be most appropriate to have a conversation with him to ask how he would be inclined to view things and review things rather than make determinations on the basis of designated expertise and a resume?
Yes, that's a great point. I think having a conversation with them and how you view things, and if he can prove to me that, like, again, this is how I'm viewing things, if he can prove that he's up to date, if he's kept following the chemical engineering literature, and he can speak with that expertise of someone, then yes, in that regard, he could serve as a scientist. But he just seems so busy with the movies, and he's a quite impressive man apparently. So maybe he has kept up with the chemical engineering. But I think that's a great point, that you shouldn't just look at someone on paper. You should also talk to them. And that's, like I was saying, it's a great way to say, okay, like, my job title is a public health program specialist, right? You wouldn't necessarily think that I can represent OHRP in something like this and talk about the regulations, but in talking with me, I can do that task. So talking with the individuals that you plan on having on your IRB is actually a great thing to do to find out how they view themselves, if they have that expertise.
Yeah, I know that we're past time, Michael. There are many other questions that remain unaddressed. I will say that if you would like us to address a very specific question, please do email us at ohrp@hhs.gov. We will do our best to respond. Michael, I believe that you will also go through these questions and attempt to answer those that we have not addressed. Any other final remarks?
Hopefully the presentation was very thought-provoking, gets you thinking about the regulations, perhaps even excited about the regulations, which I know is hard to do at times. And I hope you enjoyed it. And as Mariana said, please feel free to email us anything, and we will keep the chat here, and I will go through. We have your email from your registration, and I'll email everybody, or I'm sorry, I'll email you your individual answers.
And please, there were some questions about the convened review process, the expedited review process. Tune in next week. Michael will address all of those things in the presentation next week. And as I said in the chat in response to many of your questions, yes, the slides and the recording of this presentation will be posted. I've provided links to the resources that Michael referenced in his presentation in the chat, but they will also be included in the slides when they are posted on our website. That is all.
Enjoy the rest of your day.
Thanks all.